is awful. Awful.
Awful. A-W-F-U-L.
Correct. You got it right, so can you get to your seat? I said you are small, but watch out too. Now, we go to speller number 178. Can you come forward, please? Your first word is began. Began. That is the past participle of begin.
Begun. B-E-G-U-N.
Correct. You've got it right. Your second word is drunk. Drunk. Past tense of drink.
Drunk. D-R-A-N-K.
Correct. Your third word is tricky, but you can manage it. Conscientiously. Conscientiously. From the word conscientious.
C-O-N-S-C-I-E-N. C-O-U-S-L-Y.
Sorry, you've missed it. Don't worry, just take to your seat. Speller number 90. Your first word is water, and I'm talking about the limited number of people or amount of things that is officially allowed somewhere.
Q-U-O-T-A.
Correct. Your second word is quarterly, but now quarterly means produced or happening every 3 months. That which happens every 3 months. Quarterly.
Q-U-A-R-T-E-L-Y.
There is something that you missed. Kidogo too. The next speller is number 214. Your first word is bookworm. A person who likes reading very much. A bookworm.
B-O-O-K-W-O-R-M. Bookworm.
Correct. Your second word is lukewarm. Lukewarm.
Lukewarm. L-U-K-E-W-A-R-M.
Other top 10 counties account for 93% of cases. And as of yesterday, all counties in the country have reported cases, with Nairobi bearing the burden of it all with about 18,488 cases, followed by Kiambu with 2,335, then Mombasa with 2,260, Kajiado with 1,727, Machakos having 1,125, Busia having 945 cases, Nakuru having 713 cases, Uasin Gishu 432. And this continues on all the way to county digits. We have Turkana with 78, Meru with 69, Kwale with 67, Siaya with 65, Lamu 64, Taita Taveta 63, Nandi 58, and then counties like Elgeyo Marakwet and West Pokot that have single digits, with Elgeyo Marakwet having 6 and West Pokot having 6. And from these cases, and reflecting that to date, Nairobi and Mombasa County continue to be the counties that have the highest attack rate. This means that if you're living in Nairobi and Mombasa, you're at greater risk of transmission, of getting this disease. Nairobi stands at a very high attack rate of about 420% per 100,000 population, whereas Mombasa stands at about 187. The national average, when we compute, looking at all our counties in the country, stands at about 66 per 100,000 population. And when we look at our caseload, in terms of local and imported transmission, We've emphasized over and over that we've already established community transmission, particularly in the high burden counties, and that in terms of disaggregation by male or female, the male population continues to be the one that is greatly afflicted. To date, in terms of cumulative count, we have about 20,236 males affected and about 11,205 females. Now, reflecting on age disaggregation, we note that to date, in terms of the 30 to 39 age group, they have accounted for 33% of the cases, with a count of about 10,283. And we continue to take this as a wake-up call for young people, reminding them that the disease is real and it is claiming lives. And when we look at our case fatality rate, it stands at 1.6%, with a total count of 516 cases confirmed. This rate, of course, one death is not acceptable, but continues to be below the national average. And in terms of looking at fatalities, much like our confirmed cases, our male population again continues to be greatly afflicted when it comes to fatality, with about 386 of them being male. Yesterday, we looked at our positivity rate, and I remind you that that stands at 7.9%. And we were able to look and see, in terms of trying to explain to you how the curve will continue progressing in terms of this positivity rate and the goals that we have of lowering this to 5%. When we look at the symptomology, again, taking stock of the week that has passed, the picture remains the same, in that 7% of our cases are symptomatic. 51% of these cases, in terms of symptoms, continue to be the symptoms that we've discussed. Cough is the leading presenting symptom. Fever, 37% of our patients have fever, whereas 27% of them have difficulty in breathing. And in terms of asymptomatic cases, our cases stand at 93%. And this perhaps is a double-edged sword, because it means cumulatively only 93% of our cases are symptomatic, and that's a good thing. However, if we look at it on the flip side, it means that 93% of our cases can be potential transmitters of this disease, seeing as they don't demonstrate any symptoms. Now, in terms of recovery, we continue to record recoveries. Again, we celebrate our home-based care program, noting that we've had a set number of recoveries from it, and we continue to implement this program in terms of it reducing the burden on our healthcare facilities. When we narrow down to our healthcare workers, we note to date about 885 of them have been infected, with 16 deaths reported across the 35 counties. And in terms of critical care, to date, we have 31 patients who are currently in ICU units across various health facilities in the country. And while we've recorded some significant gains, we do note that in order to be able to fight this pandemic, we need to fight issues such as stigmatization of patients, and we do continue to receive disturbing reports about how several families and even individuals have been stigmatized by their fellow Kenyans. And we continue to appeal to people not to stigmatize, because it is important that we all adopt a brother's keeper approach in trying to stamp down this pandemic. Finally, we should remember, again, we have 3 remedies against coronavirus in terms of being able to contain this virus. We remind everyone that you need to wash your hands with soap and water. You need to wear your face masks at all times in public places. You need to maintain social and physical distancing, and we need to avoid forms of public gathering. Reviewing the week that has just passed, in terms of our COVID statistics, we ran a sample size of 4,470 in the last 24 hours, of which 322 people tested positive, bringing the total number of positive cases in the country to 31,063. And from all these cases, all were Kenyan except 9 who were foreign. In terms of disaggregation by sex, we had 179 male and 143 female. The youngest is a 3-year-old baby, whereas the oldest is 92 years. And in terms of disaggregation by county, Nairobi continues to lead with 106 cases. Kajiado has 53, Machakos has 25, Nakuru has 25, Kiambu 23, Kisii 23, Busia 13, Mombasa 11, Kisumu 5, Bomet 5, Garissa, Homa Bay, and Nandi all have 4 cases, whereas Uasin Gishu has 3 cases. Kitui, Nyandarua, and Taita Taveta and Turkana also all having 3 cases. Nyamira has 2 cases, Kericho 1, Murang'a 1, Vihiga 1, and Makueni 1. We have provided for you the disaggregation of each county by sub-county in terms of the caseload. In terms of our recoveries, we have 288 patients who've recovered from the disease, of which 190 are from the home-based care program, whereas 98 have been discharged from various hospitals. Our total recoveries stand at 18,157, and we do really sincerely appreciate our healthcare workers for the good job that they're doing. Unfortunately, today we've lost 16 patients who succumbed to the disease, bringing our fatality to 532. And we would like to pass our sincere condolences to the families and friends of all of those who've lost their loved ones. Thank you, and we now welcome a Q&A session.
Any questions? No questions? Yes.
Okay, thank you, Waziri. I'm Haimba from Ebro TV. Maybe following the statistics that you have actually released today of the positive cases, the new positive cases, do you feel maybe as we enter the month of September, there is hope that these cases will have to go down further?
My name is Dorcas Wengera from Citizen TV. Yesterday you gave us the trend in the curve, but there was an observation that there's a bend in the curve. What does that bend mean, and what does it tell us? And then also, what is the epidemiological term lifting the line in terms of health capacity workers, and where are we with lifting the line other than just flattening the curve?
Good afternoon. I'm Purity from KBC. My question is in regard to the health workers' strike. There is a notice already, and in Nairobi County, if I'm not wrong, they're supposed to begin their strike today. Are there any talks that are ongoing in this regard? Again, on the protection of healthcare workers, I know there is a lot of conversation going on, especially with the supply of the PPEs on the counties. Again, there are counties that have been highlighted not to have already met the 300 isolation bed capacity, and we have our graph are still not at the peak, as you say. Update us on the county preparedness. How many counties are yet, if you could list them for us, are yet to achieve the 300 bed capacity?
Zainab Mohammed, TV47. Following up on Purity's question, we've done a spot check with different hospitals where patients are being turned away due to the doctor's strike. What is the ministry doing towards solving this?
Thank you, Zainab and Purity and Kaimba for your questions. We'll begin with the issue of the doctor's strike. Yes, I think this was Purity who asked, are there discussions underway? Yes, there are discussions underway. As early as last night, we continued to have discussions with members of the union and healthcare workers, impressing upon them that perhaps now is a critical time to be mzalendo and ensure that we are taking care of our country, but also hearing their needs and their concerns that they have and coming to a place where we can be able to meet those needs. These discussions continue. There are a few challenges here and there, but they're being worked out to ensure that we have an amicable resolution to this. Concerning the patients that are being turned away,